Good morning, it's Friday, folks. It's Mile High Living, and I'm Gina Bellich. Over 10 years ago, the first family-owned and operated American Vein and Vascular Clinic opened in Pueblo, Colorado. And since then, they have opened 7 additional facilities in our state. They are a world-class network of vein and arterial diagnosis and treatment centers helping those in need. And we've got the founder, Dr. Gordon Gibbs, with us here today to talk a little bit more about this. Dr. Gibbs, I'm so glad you're here.
Good morning, thank you.
Tell us a little bit more about the American Vein and really how it got started.
Yeah, so we started about 10 years ago, as you mentioned, really out of a need. We saw that there were a lot of people with vein problems out there that really didn't have access to great care. And the technology in vein care has really come a long ways during that time. And so the historical norm of vein stripping really isn't something that applies to us. There's a lot better technology. It's much less invasive than it used to be. And the treatment outcomes are just much better than they used to be. So it was really born out of a need.
Talk about some of the symptoms of venous disease that maybe some people just don't even know about.
Yeah, sure. So some of the common things that people present with are going to be swelling, aching, cramping, heaviness in their legs, more so towards the end of the day. Sometimes people have nighttime symptoms like cramping and restlessness. They can either wake them from a sleep or they can prevent them from going to sleep in the first place.
Talk about the exam that is really needed to see this and to figure this out.
This is one of the things that I think has really made vein problems a lot more different now than they were historically, is really the ultrasound exam. So an ultrasound is a tool that we use pretty commonly in the clinics that allows us to see exactly what's going on the inside of the veins. And so some of them are healthy and normal, some of them are abnormal, and it's those abnormal ones that we really want to pinpoint, identify, and potentially treat, because those are the ones that are causing the symptoms.
Those are the ones. Talk about how long an ultrasound exam actually, takes for that, and really what does that consist of?
Sure. Well, I'm glad you asked, because that's one of the things I feel like really sets our clinic apart from some other practices out there, is really the detail that we apply to that ultrasound. So an ultrasound exam in our office takes about 60 to 90 minutes. And we look at the patient laying down flat, we look at them standing, we look at them in between, because the veins behave differently with the patient in different kind of orientations. So, you might go to another practice and they might spend 15 to 20 minutes or so. And I feel like getting that detailed ultrasound up front is really what allows us to create the best treatment plan so that people have a great outcome.
All right, Registered Vascular Technologist. I was saying right before we came on what a great title that is,
yeah,
right?
An RVT.
RVT. Can you talk about the training that they get and really what they do?
Yeah, so as I mentioned, ultrasound machine is something that we use in most of our patients, and an RVT, or a Registered Vascular Technologist, or Registered Vascular Sonographer, is somebody who has specific training on using that machine, and specifically looking at blood vessel problems, whether they be arteries, whether they be veins, whether they be the heart, whatnot. So we can basically have hired people who are really good at running those machines and who really know the nuances of identifying vein problems so that we can come up with the best treatment plan.
You mentioned it a little bit, but let's go into it a little bit further and talk about how your ultrasounds really are different than the competition or anyone else out there.
Yeah, so it really comes down to the details. So our sonographers, this is what they do all day, every day, and they're very good, they're very capable, and I feel very proud in the team that we've assembled, because that really does help set us apart from somebody who might be dabbling in vein care or a smaller practice or whatnot. Is just the depth of expertise that we have on our team is really second to none, I believe, in Colorado, if not the country.
Wow. Well, that is good to know. That's something that's so precise in what you're doing. Do you also scan, and I'm going to read this off here so I don't get it wrong, it's arterial disease or DVTs, right?
Sure,
you do that as well, right?
So it's all, we want to identify if somebody has a problem with their circulation. So a circulation problem can be arteries, meaning delivering blood down to the feet. It can be veins, meaning bringing blood back to the heart. So if you have a blockage like PAD, sometimes people have heard that, is a blockage in the arteries going down to the feet. That can cause a certain spectrum of symptoms. If you have a problem with the veins bringing blood back to your heart, that can cause a different spectrum of symptoms. So we really try and identify, is it just arteries? Is it just veins? Is it a mixed pattern? And with that information, we can provide the best recommendations.
Well, you've got some specials for our viewers today. Why don't you tell them what that is?
Sure, yeah. So it's Socktoberfest at American Vein. So compression stockings are something that we use for many of our patients. It really helps get the blood out of their legs. It prevents that pooling. It makes people's legs feel better. So we're offering a special with custom fittings of compression stocking, so people can come in, they buy 2, get 1 free, so it's basically 30% off. And these are medical grade compression socks, so it's not the kind of thing that you might just stumble across in Walgreens or Amazon or whatnot. They're custom fitted for our patients specifically based on the size of their legs and their situation. So you don't need an appointment. You can come right into any of our clinics along the Front Range, and we'll get you fitted for them and get you taken care of.
Well, I didn't even realize you could do that with those socks.
You can.
All right,
yes.
that's pretty cool. All right, Dr. Gibbs, we appreciate you coming in. Thank you so very much.
It's my pleasure. Thank you.
Let's remind everyone you can love your legs again. American Vein and Vascular Institute offers minimally invasive in-office treatment options for venous disease. And for the month of October, it's Socktoberfest. Buy 2 pairs of compression socks and get 1 free. Call their number today at 8445-MY-LEGS. That's 844-569-5347. Or you can visit them at AmericanVein.com for more information. They paid for today's segment.